I hope everybody's had a good chat and a good lunch. What we didn't tell you was that before we go into the next session, Rachel was handing out the questionnaires for the quiz on this morning's lectures, and we are paying a particular attention to the correct spelling of the various muscles that make the larynx function, and I'm sure you picked them up as we went along. No, joking apart.
Surgery.
Yeah. Oh, sorry, surgery. Yeah, there we go. There we go. That was just to test you. Probably me. So I've got no chance with the long muscle names. Our next speaker needs no introduction. Mark Johnston is a fellow vet, but also an eminent trainer of the thoroughbred racehorse and a student of the breed and of the management of the racehorse. And Mark will give us a presentation on the practical view on tendon rehabilitation. So we've gone from the neck, from the throat, to the leg now. The words are slightly less complicated.
Thank you. When Stuart Williams called me and asked me to do this, he said that the idea was to make the sessions a bit less academic and more open to all. And I immediately thought non-academic. That's me. And then he said that the topics were going to be wind issues and tendons, and those two issues are probably the bane of our lives, and so I thought that's me as well. That's great. Yeah, I can do this. And then as time went on, and I saw the title for my talk, A Practical View on Tendon Rehabilitation, I started having a few second thoughts about it. And I sort of feel maybe I'm a bit of a Swiss being here. You know, maybe it should be a jump trainer, Willie Mullins or Nicky Henderson, somebody that really has some practical experience on rehabilitating horses and from tendon injuries and getting them back to racing. Because when I started to think about it, and I've been giving this a lot of thought over the last few days and asking other people and so on, and trying to think if we could name a horse that I'd had that had a tendon injury and we had rehabilitated it to the stage that it then had a long and successful career as a racehorse, and I couldn't think of one. Now I'm told, and I imagine that there are a large number of jumpers out there that at some stage in their career have suffered a tendon injury, and they are racing at the highest level. And nowadays we're seeing some of those jumpers are racing at a very high level on the flat as well. Maybe not the highest level, but pretty close to certainly at group race level and pretty close to Group 1 level. And I don't know if some of those older horses have suffered tendon injuries earlier in their careers, but I'm guessing that some of them must, and they've come back to something close to the highest level. But sadly, in my experience, that hasn't been the case. So I started thinking, maybe the title of my talk should have been A Cynic's View to Tendon Rehabilitation rather than a practical view. If we go, obviously I graduated in 1983. I remember one of my final year reproduction project was done on ultrasound scanning. So ultrasound scanning was around, but it was, as far as I'm aware, it was principally used in reproduction. And the 3.5 years I spent in practice, the last practice I was with had an ultrasound scanner, but again, it was only used in reproduction. And when I went into training, any vets that I was using for for second opinions and so on, didn't have scanners. I'm trying to figure out what year it was I first saw a scanner used to scan a tendon. I'm sure it was the early 90s because I remember the horse and I remember the outcome. I can't actually even remember who the vet was who came in to scan this horse's tendons, but he told us it was the worst case he'd seen, and he gave a very, very poor prognosis for it. He showed me the scans, which were all full of black areas, and to us it was a complete disaster. Looking back, it was a 2-year-old with juvenile tendonitis, and the horse was fine. So it must have been pretty early in my career because I probably hadn't seen a lot of, or certainly not to that extent, juvenile tendonitis at that stage. I've seen plenty of them now, and generally they don't worry us. There's always I can't say we've never seen a juvenile tendon that went the wrong way, because we actually had one last year, and so these things, they do occur. But so in those early days, I was very much in the camp that the scanners started to come along and vets were using them, and I was always looking at the visual approach versus the scanner, and I was always on the side of, if visually you think the tendon's good and the scanner tells you it's bad, then the scanner's wrong, and vice versa. If the tendon looks bad and the scanner tells you it's okay, the scanner's still wrong. Times have obviously changed. I think at home we are probably on our 4th ultrasound scanner, 3rd or 4th. So they've been advancing, and the vets that I employ to use them have been advancing dramatically. And I would say that at home, I'm still going out there and saying, I'm more interested in the visuals than in the scanner. But generally, with most practicing vets, it would be the other way around, that they're basing their diagnosis and their prognosis more on scans than on visual appearance of the tendons. Going back to those early days for me, and it's still what we say of as visual assessment of the tendon, the critical point was when you see some bowing in the tendon, and to me that was largely the point of no return. When the horse has a bowed tendon, we can do all sorts to make it look better. We can maybe get it back to the race course, but in my experience, none of these horses ever came back as good as they were, and none had a long and successful career. They always ended up with a recurrence. The most notable ones that really spring to mind in the early days of Mr. Bailey's won the Guineas. I pressurised his horse, probably in hindsight, if I could wound the clock back and train him again now. He'd won the Guineas, and he'd have gone to the Irish Guineas and the St James Palace, instead of which, very early in my career, first top-class horse I had, and I was obsessed with trying to win the Derby, and I stretched him out in distance. He ran in the Dante, he ran in the Derby, he bowed his tendon in the Derby, and how clever were we then? We could get him back so fast that we ran him in the Sussex Stakes, but he never ran again after that. Only 2 or 3 years later, I had Double Eclipse, full brother of Double Trigger. He bowed his tendon. He came back. I was trying to check beforehand how long he had off. It appears just from looking at the form that he had a year off the track, and he came back at listed level, but nothing like the level that he was at before the injury. And again, I've forgotten now, but he had maybe half a dozen races. In very recent times, I had Subjectivist, and that's quite a long story to look at, because he actually appeared to have injured his tendon in a race in Dubai. It's a 4-year-old, and filled him full of anti-inflammatories. He got scanned the next morning because there was nobody there to look at him the night of the race. And they said I'd already got on a plane by then, and they said he was okay. And he stopped off here in Newmarket on his way home, and he got scanned and everything said he was okay. He then, next start was in the Ascot Gold Cup, so sort of 3 months later, and he did the tendon on the other leg. But, in hindsight, there was possibly damage to both tendons in Dubai that night. He had nearly 2 years off, came back and ran twice more. So yeah, he finished third in an Ascot Gold Cup on one of his 2 starts when he came back, but he went as well. Now, there could be horses lower down the pecking order that I've forgotten about that did come back and did race successfully later, but I don't remember them. And I couldn't find anybody on my team that could name a horse that we'd had and that we'd brought back. So maybe I'm a Swiss, maybe I'm the wrong person to be here. That if you wanted to hear what the secrets are of getting them back, I'm afraid I don't have them. I have to say that I'm sure we're going to hear about treatments, old and new, from the next couple of speakers. And I have to say that I haven't tried many of those radical treatments. So I've seen through my time in vet practice and training, obviously firing and blistering were around long before me. And then we've seen the carbon fibre implants and the tendon splitting and various injections into tendons. And I personally I can't actually remember us ever doing any of those things to a horse. But I have trained horses that have come to me after firing, after, probably in my early days, trained No End that came to me after blistering. And more recently, the odd one that's had other treatments. And again, I've had no long-term success with them. So to look at what we do, what our idea of rehabilitation for a tendon is, back to how we assess the damage in the first place. And I'm not for a second saying that I now ignore the scanner. And so, I'll get shown these horrific holes in the tendons on the scanner, which seems to be the critical point as far as scans are concerned. Once it's got a hole in its tendon, there's no going back. But for me, it's still that bow and that profile that is the critical point. And so our first indication that we might have a tendon injury, we throw all the anti-inflammatories we can at them. This is, I should maybe have said at the start about not being academic. We're not, I've had to point out to people over the years on numerous occasions that we're not a research establishment. I train horses, I'm not studying them. And so we don't have, for all we've got comprehensive veterinary records going back 20 years. And many times we've been approached by universities and the BHA to use those records, but they were never put in a format where you could press a button and pull information out of them, because that's not what they're there for. And so while I've got all those records, and if I trailed through, I would be able to tell you what treatment these horses had and how long they had off and how they presented. But the records are there, but I've not yet found anybody with the time or inclination to pore through them all. So everything I'm telling you is purely from anecdotal evidence and theories that I had that sort of made sense to me, and I don't have any data to back them up. But I've always worked on the principle that clearly when you have a strain in a tendon, there's inflammation. Inflammation is the body's way of treating injuries, but I've always worked on the basis that initial inflammation also causes a lot of damage, also causes a lot of disruption of the fibers, and that bowed tendon, which is so critical to me, is which came first, the chicken or the egg, but the bowing was as a result of the inflammation. So at the first sign of any indication of a tendon injury, which might be heat, thickening, lameness, anything that we're suspecting that we might have a tendon injury, then we hit them as hard as we can with anti-inflammatories, bute and corticosteroids, and basically lots of cold therapy, ice, water, and so on. And we do everything, and bandaging, of course, and everything we can to stop that swelling. Often it's not enough, and then that's followed by time. I think it was Jenny Pittman. It was certainly a jump trainer, but who once said that you may as well fire its back or blister its frog, because it was all about the time off that you gave them. And I'm sure there's an element of truth in that, but as I say, I've given them time off to the extent that, subjective is nearly 18 months, and it hasn't made a difference. At the end of the day, they still go again. And I still, with our John Martin has just left us, but was with us for 10 years, and him and I slightly disagreed on the treatment of these, and that John would have been very much in favour of throw it in the paddock, that was the time off was time thrown in the paddock, whereas I always fear that out of sight, out of mind in the paddock, it's galloping round and further damage is done. So I would have been more in favour of controlled exercise and keeping them in and swimming and so on for weeks and months on end before coming back to walking and swimming, continuing and so on, and a very, very long, slow return to full exercise. None of it works. Or that is my experience. So that it's led me to a belief that prevention is far more important than cure, because there is no cure. And we've felt that to some extent right from the beginning of my career, and I don't have the data to back it up. I was looking yesterday back at some of these horses I had in the early days, Double Trigger, who raced till he was 7, and from the age of 4, every race was at 2 miles or more, and he raced till he was 7. Giovanna's Pace came to me when he was 5 and raced till he was 11. He did a tendon on his last start, but at 11 years old, and every race, not every race, but from about the age of 6 onwards, every race was at 1.5 miles and above. And I don't feel like I've had those kind of horses in recent years. And I don't know that if it's because I'm doing things differently or not. In very recent years, one thing that has changed is our prophylactic use of anti-inflammatories, in that right back to those early days, any horse that raced at 1.5 miles or above at group race level, there's 2 reasons why it was horses at group race level. One was that obviously, we imagine those horses to be putting more strain on themselves. They're going faster, they're better horses, they're more competitive. And so I consider them more likely to suffer a soft tissue injury. And the second reason was that at group race level, they weren't going to run again in the next 2 weeks. And for virtually every single one of them, I knew that it wasn't going to run again in the next 2 weeks. So our policy with all those horses for many, many years was 10 cc's of bute at the track straight after the race, and then oral phenylbutazone for a minimum of 5 days when they got home. That policy continued right up until, I'm not quite sure when it was that the rules changed. I'm sure there are people here who could tell me, but probably 7 or 8 years ago, when we could no longer have drugs on the race course ourselves, and we certainly couldn't go in. Maybe it's longer than that. I'm not really sure. We couldn't go into the stable and inject them ourselves. And also, John Martin, that I've just mentioned, he changed it a bit in that with some of the horses at slightly lower levels, I'd be concerned at the races that it had had a hard race over a long distance, and I'd be phoning home and asking what entries this horse had coming up to consider, can I give it anti-inflammatories? So John introduced that we used corticosteroids on the racetrack instead of bute, and so we give them 20 cc's of dexedressin straight after the race. And then we considered when we got them home whether they were going to have phenylbutazone or whether they didn't need anything or not. And so that has been our policy probably for about 4 or 5 years, but it had to be administered by the vet on track. And I think with one exception, at Hamilton a few years ago, the vets were all happy to do that. Then recently, it came to light that one vet questioned that said that he shouldn't be treating a horse without examining it. And I felt that was perfectly fair enough, that he shouldn't be treating a horse without examining it. And I was quite happy with that. But then it came to light that if any examination or treatment that is done of a horse on track needs to now be reported to the BHA, and that horse will then go on the BHA's list of horses that has to be examined before every start. And, like it or not, the reality of the situation, despite the fact we're told that trot-ups and so on are for the benefit of the horses and the benefit of us and so on. I don't think I was the only trainer who moves heaven and earth to not have our horse on that list where it's going to be examined by the BHA before the start. So it was a big downside to us to be told that the horse would go onto that list. And so for about under a year now, but we have stopped that treatment of horses prophylactically. It's too early days to say, is there a negative to that or not, or did it ever? And I don't have any evidence to support that helped in the old days. Interestingly, we have Tim Morris come in once a year, mostly to do a biosecurity check on our procedures in the yard, but also to advise on veterinary legislation and many things. And I was discussing this with him, this fact of the having to stop doing prophylactic treatment on the racecourse. And he pointed out that even the issue that I had thought was perfectly acceptable, that the vet should not be prescribing drugs for a horse that he hasn't examined. Tim didn't actually think that was the case, and he used the example of calf pneumonia, where certain conditions on certain farms, certain climatic conditions might be known to result in calf pneumonia, and that it is perfectly acceptable procedure for a vet to prescribe medicines to be used in those circumstances where the farmer or the attending veterinary surgeon knows that these conditions are likely to lead to a case of pneumonia. So to his mind and to my mind, the same applies to the racehorse. If we know that these conditions, a hard race over beyond 1.5 miles at a high level, puts the horse at much greater risk of a tendon injury, then we know that those conditions are predisposing to tendon injuries, and so it's perfectly reasonable for the horse to be treated on the basis that that is the policy of the attending veterinary surgeon at home. So I would argue that this has been a very retrograde step, and maybe it's sort of going off piste a bit from the idea of how we rehabilitate the horses. And as I've said from the outset, I've got no simple answers to how to fix them. I'm dearly hoping that we're going to hear some answers from the next couple of speakers. But like the rest of you, I'll be watching that with interest, and my attitude I will be cynical. I can't help myself in that, and I've seen just far too many of them that don't make it. So for us, again, it was a jump trainer. I'm not quite sure. It might have been Jenny Pittman again, who said that having a bit of a leg is like being a little bit pregnant, and I think that's undoubtedly the case. That it's the worst. It's worse than anything else. The two subjects that we've touched today. When you hear it making a noise, oh dear, because maybe you can live with it, but the only way is down. It's going to get worse, not better. And the same if there's any bow in that tendon, you've got it for life. Thank you.